variety of different applications. So you talked about cancer and pain and nausea. So can you elaborate a little bit more on some of those arenas where it's helpful?
Yeah. So cancer, I'm seeing a lot of patients they're called cannabis naive or medically naive, older patients.
Mm-hmm.
They may have used cannabis in the 60s and got bored with it or didn't like it, but now they have something serious like cancer or Parkinson's. So I'm seeing a lot of cannabis naive patients, and they need to know about dosing also and whether it's going to help. And it's a mixed bag as far as what cannabis is helpful for as far as cancer. We do know it has some anti-cancer properties. I wouldn't say it's a cancer cure, although some people are touting cannabis as a cancer cure, and sometimes it's those people that are also selling the medicine
Right.
that might be over promoting it.
Mm-hmm.
But some studies have been done, even here at California Pacific Medical Center, and we have Sean McAllister, who does research there, speak to our group, the Society of Cannabis Clinicians, and they've done studies. Other countries have done studies. And basically what they found, let's say one type of cancer called glioblastoma multiforme, so it's a type of brain tumor, and that seems to respond better than some of the other brain tumors.
Oh, interesting.
And so some studies show that the chemotherapy and radiation therapy, along with cannabis, works better than either of those alone. And another study done somewhere else in the world showed that CBD and THC together work better than either alone. So, we're slowly breaking it down to like what parts of the plant are useful. Does cannabis replace the chemotherapy? It turns out maybe additive to it. So it's not like we have to throw out Western medicine too, because a lot of that is very important. And in fact, I'd consider cannabis Western medicine too. I mean, it's herbal, but it really is, it's an allopathic medicine. It's used in pharmacies from when it was rediscovered in Western medicine from about 1839 till it became somewhat illegal in the United States in 1937 with the Marijuana Tax Act.
Ah, right. Oh, the history of the use of different substances for health is so fascinating.
Yeah.
And you're one of the experts in the country, if not the world.
I'd say in the country.
In the country, yeah.
In California. And I'm not a researcher, although, I certainly have my series of kids that I can do statistics from, but, I'm more of a clinician for the last, 30 some years, and I have my subspecialty of the cannabis. I still do family practice, and for 37 years now, but for 20 years now I've been doing the medical cannabis evaluations, and for 5 years I have the subspecialty within that of the kids with seizure disorder and autism.
Wow. Well, so I guess I did ask you about if we know something about the mechanism of how it's, in what way is it helping children with autism or people with autism?
Well, good question, because what I found is the CBD is good for helping the seizures and probably helps the mood to some extent. And sometimes, though, the kids with the older kids, when they start getting bigger and stronger, sometimes they're more of a danger if they become violent. So a touch of THC sometimes helps them be happier, calmer, less violent, and they learn better, is what I heard from some of the parents. So it's not consistent with learning, it's just a matter of figuring out the dose. Too much of THC can make you intoxicated or sedated, but a little bit sometimes helps kids focus if they have ADD or if they have other reasons for not being able to focus, like autism. So it doesn't work the same for everybody.
When you do it, you kind of have to say, okay, how is it going to influence this individual? Because we don't absolutely know how any one individual is going to respond to a particular.
That's right. Yeah, and the biggest problem that I have then once I see the parents is how are they going to find the medicine that's going to help? So fortunately, the Society of Cannabis Clinicians, one of our journal is O'Shaughnessy's, the Journal of the Society of Cannabis Clinicians, and our editors at O'Shaughnessy's, Fred Gardner and Martin Lee have their own website called projectcbd.org. So you can go there and you can see, you can go to one part of the website, I think called Locate. You can see who has CBD available. Because not all dispensaries carry it, not all dispensaries even measure their medicine.
Oh, right. So that's a fairly new thing, last several years
the
or
last
something?
5 years.
5 years.
Some dispensaries have been measuring their medications for THC and CBD. And I think by 2018, when this trio of bills that Governor Brown signed becomes fully implemented, all the dispensaries will be required to be testing their medicine. So it's being phased in, and a number of them are already testing their medicines so that they can tell whether they have CBD strains.
Interesting, and also is testing for pesticides and other things of that nature, which could be harmful.
And then there's some that, that are some dispensaries that are not even listed on projectcbd.org that have CBD too, so I try to keep track of who has that.
So that you can let your patients know where things are available.
Yeah, I think the important thing is it shouldn't be any dispensary that has a collusion with doctors. Doctors and dispensaries shouldn't be colluding. So it's nice to be able to refer to an outside source, but they're not always unbiased. So I don't have any financial interest with any dispensary, so I like to let people know at least who the local dispensaries are that do carry CBD.
So it's convenient for them to actually get what they need.
Yeah.
So I think I mentioned previously I've written a couple books. One's Outsmarting the Dementia Epidemic, and one is Super Brain, Maximize Your Brain Health for a Better Life.
Great.
I just wrote a new one that's a little more politically oriented, Code Blue in the White House. What successful presidents sell voters to win elections. But in the vein of dementia and Alzheimer's, you'd said that you work with, because hopefully we'll be able to have you on a different segment for my Outsmarting Dementia Summit. And so give us a little hint about how you are using cannabis in situations where people are in like memory care facilities or Alzheimer's.
Yeah, there's a few memory care facilities that are now allowing patients to take their medicine there. And at least one of them, a couple of them I think are even dispensing it. A lot of places say it's fine if the patient takes it, but the parent or the family has to bring it in. But at least a couple of them will allow a doctor to write the order as long as it's listed as so many milligrams as opposed to even half a cookie. Something medicinally oriented so that they know how many milligrams.
Something more scientifically broken down.
Yeah, so that's reassuring. And so THC or CBD can be very helpful. With dementia, you don't necessarily want a lot of THC because of the short-term memory loss. On the other hand, sometimes that's a minuscule problem compared to the agitation that patients get when they had some memory loss. And if it's somebody that's used to using cannabis, they might feel more normal. So one of the patients that I was following was somebody that I'd known for many years, and she'd always been a cannabis user. And so, when she was being given the cookies or the tinctures by the staff, that helped to some extent. But when one of her family members took her out to the car and let her smoke one, it was more like that ingrained memory, like now she felt good. So people that are used to using cannabis, you should be allowed to use it the way they are used to it if they can tolerate it physically. Once they're in a home, but they might have to be taken out of the facility if it's going to be smoked, let's say. But it's fortunate that there are other ways of taking it, whether it's in an edible form or a liquid tincture you put under your tongue or vaporizer.
So I know that in the Alzheimer's and dementia arena, it's talked a lot about how the music that people used to listen to. They have family members create like a tape of all their favorite music, and that often alerts the person, and all of a sudden they get much more present. They're actually able to interact, and they aren't in wherever it is. And if you have severe Alzheimer's, I mean, I don't really know if people know what's going on inside, But so with this music, it actually brings them alive. They're back, they're engaged more, and so that's like old memory. That's through auditory sense. But But would you say, as far as our senses, would you say that the olfactory sense is like one of the most basic ones for neurological? And so using cannabis, if someone's done that for a long time, there's this olfactory stimulation that goes deep into the brain, and so maybe it stimulates the more normalcy or something.
Yeah, I think the olfactory, that's cranial nerve number 1 is the most
Right.
primitive. I think even worms have a primitive
Mm-hmm.
olfactory system, right?
Uh-huh.
Because it's the first thing that you touch,
Uh-huh.
is your proboscis or the nose,
Uh-huh.
and so yeah, that's part of the therapeutic effect of cannabis, or food. Is you smell it, you taste it,
Yeah.
very primitive things, and then salivary glands start. So I'm sure that there's some of that same thing for cannabis. It has a certain smell and a certain memory. Whereas edibles may not have that same memory
Right.
for some people.
So the it's often stated that one of the first signs of dementia is loss of smell.
Mm.
And there's you can do a peanut butter test from each nostril, and if the left side starts going out first, then that may be a sign you don't smell the peanut butter as soon as the right side. And so I'm just wondering how the whole cannabis and the olfactory thing works together. As far as do you think when somebody is using it, does it increase their ability to smell or taste or anything? Is that anything that you've checked out?
I don't know if it increases their smell, but I know that it can stimulate hunger.
Right.
So I don't know if it makes the senses more heightened that way, or if it's more of a direct effect on the hunger center.
Because people with memory issues and stuff, often they stop eating, they lack of interest, and so does the cannabis help to stimulate that?
Yeah. And it's interesting too, because it doesn't necessarily make people overeat either. Diabetics can actually use it and to.
Oh, that's
enjoy
interesting,
the
because
meals.
I think the old idea was that you get the munchies and then you just.
Yeah, well, if you don't have hunger, then it helps bring the hunger on.
Yeah.
But if you have, instead of overeating things, it can, for diabetics, it can lower insulin resistance, and the type 2 diabetics, the non-insulin dependent diabetics, sometimes have insulin resistance. So they
Yes, that's usually a first stage.
They don't respond to their own insulin, and so cannabis seems to help lower that insulin resistance, so people can actually enjoy their meals. Their blood sugar, doesn't vary as much as it might, and so they actually don't necessarily want to eat more. They just enjoy the meal that they're having
Because they have that satiation, a physiological satiation of the sugar in the bloodstream or something.
Plus, there's some tricks. I mean, if you wouldn't want to, smoke one and then go shopping when you're hungry,
Right.
Because then everything looks good and you might pick the wrong thing. Whereas if you have your meal planned out and you have one just before your meal, then of course your meal will be more enjoyable. It doesn't make you want to have twice as many helpings necessarily.
All right. So I know that years ago, when I was in college, a senior in college, there was, and so that was 1975. There was a researcher who came and gave a talk about cannabis. And one of the points which you made earlier is that no one's ever died from the use of it. And that the LD50, which is the lethal dose, at which I think is at which 50% of something dies.
Something like that.
Yeah. And so that individual was saying, even back then it was well known, that you can't overdose on it because you fall asleep before that. You get to a point where you could actually consume so much.
Yeah.
It would
Well, you
harm
won't die from an overdose. You can overdose because if you're too sleepy, might be an overdose if that's not what you're looking for.
Right.
No one's ever died from overdosing on cannabis. So, the overdose would be intoxication or sedation, but not death. And one of the reasons, the main reason for that is that there's no cannabinoid receptors in the medulla oblongata, which is where the heart and respiratory control centers are. Whereas too much opiates, will suppress the respiratory and cardiac centers, and you can die from that.
Alcohol can too.
Alcohol can do that. I'm sure even the benzodiazepines like Valium, even though taking oral Valium in huge amounts make people sleep a long time, but not necessarily die. Intravenous Valium can actually kill somebody by respiratory depression.
And is that used?
Hmm?
Intravenous Valium?
Yeah, it has been. That's one of the ways of stopping seizures.
Oh, okay,
Yeah,
all right.
the status epilepticus for seizures are not stopping under any circumstances. They'll sometimes do it delirium tremens, DTs from alcoholism. People can die from that, so sometimes you have to take drastic means and you give a Valium injection intravenously to stop the seizure, but then you got to watch the breathing.
Oh, interesting. Now, is that typically done like in a hospital setting, or is it?
Yeah.
When they're taking the ER and.
Right.
Yeah. And that was something that like you learned years ago when you were working in the ER? Or?
Right. Yes, and then in medical school.
Right.
I used to be a private duty attendant when I was in undergrad at medical school, so you'd have an 8-hour shift of being with one patient, having seizure precautions.
Interesting, wow.
Or suicide precautions, or whatever they needed. Somebody to be there for 8 hours. You might be just sitting there reading the book, but paying attention, letting the nurse know this patient needs, or seizure starts, you call for help and you'd be helping hold them down. So I've actually, before going to medical school, it's been a situation like that, helping hold somebody down so that they didn't hurt themselves while the doctor came in or the nurse came in and gave the patient the intravenous Valium and stopped the seizure.
That was pre-medical school? That was like you were trying to get hours to experience or something?
It was a part-time job, plus I was getting
so we can
experience.
On the camera again, yeah. Oh, that's so fascinating.
Yeah.
Wow. So, anything else as we're wrapping up here? This has been like a really, really very informative session. I'm sure everyone's going to love
there's
this.
so much to say, but it's so it's going to be 20 years now that we've had our law in November. We're going to have,
in California here.
Yeah, in California. Other states still haven't passed it, but we've got half the states now with medical marijuana law.
Oh, is it? All right.
We've got about 4 states plus the District of Columbia with adult use laws now. California is going to almost certainly vote for Prop 64, which will legalize for adult use. So we're seeing some progress there, but it's very clear that cannabis has a lot of medical properties. We've scratched the surface. We know a lot about it, and we used to say, well, we don't know. We need to learn more, and we still need to learn more. But it's really one of the most studied plants in the world at this point. Even though our government hasn't allowed as many studies as we'd like, other countries have. If you go to PubMed, which is the National Library of Medicine.
PubMed.
PubMed, do a Google search for that,
and
it'll be the National Library of Medicine, and you'll see all this. You can put in keywords for carcinoma, like cancer of the esophagus, and cannabis, or CBD, or THC, and you see what studies have been done anywhere in the world. So even if we haven't done the studies here, you might see that Israel has done something, Madrid, Spain might have done something. So different researchers around the country, around the world, are doing some studies.
Yeah, I know that when I was doing Japanese translation for National Cancer Institute in Philadelphia, like from 1978 to 83, occasionally there would be articles that came in that had to do with THC and all. Even back then, that was a long time ago.
Yeah.
So there is a long history of research and I know that also recently I was at a herbal symposium, and Don Abrams was there. He's an integrative oncologist, and he had a number of slides that talked about cannabis and its relationship and use in cancer.
I've gotten to know Don over the years because he came out of being an AIDS clinician at the very beginning of the AIDS epidemic, and so clinician and researcher right on the forefront, and one of the first to realize that cannabis really could help the wasting syndrome of AIDS, and was able to actually do studies with NIDA, National Institute on Drug Abuse's poor quality cannabis, but to prove that patients could actually gain weight instead of losing weight. Yeah, so it's fascinating to hear him give his talks about his experiences there.
Yeah. All right, so once again, Dr. Frank Lucido, and if you want to get information from him, you can go to drlucido.com.
Yep, drlucido.com, so drlucido.com, or email me at info@drlucido.com.
Fantastic. Thank you very much. And I hope that we can have
in
you
Berkeley, family practice and medical cannabis.
Berkeley, California.
And also medical legal consulting. I've been a medical legal
excellent.
consultant, testifying in, it used to be malpractice cases for the plaintiff, and then with medical cannabis law passed in '96, I transferred that medical legal consulting knowledge to medical cannabis, where I defend both doctors and patients if they have legal issues. And sometimes there are CPS issues like
Child Protective Services.
Child Protective Services. Nowadays, CPS pretty much understands that cannabis, kids can be cannabis patients, but at the beginning, they thought, geez, is this child abuse, etc. But it's been pretty much accepted now that this is a medicine and it should be looked at like any other medicines. You always look at the benefits versus the risks.
So the parents were being prosecuted for having their children on cannabis for the seizures and autism?
And in some states, that's still going on.
Oh, wow.
Yeah.
Wow.
So sometimes I've had to testify or write deposition or write a...
for other states and all.
For other states, yeah.
Well, that's good. That's good for our listening audience to know the incredible resource that you are. So thanks again for being on.
All right.
And we look forward to everyone. Once again, we have all these very interesting podcasts on natural solutions with Dr. J. So tune in for the other ones. And Dr. Lucido will hopefully be on again.
Great. Thanks, Jay.
Thank you. To buy your copy of Superbrain, maximize your brain health for a better life, go to superbrain-thebook.com. That's superbrain-thebook.com. Information can also be found on naturalsolutionswithdrj.com.